Hello, happy Friday. Oh wait, even though when you're listening to this video it may not be Friday, but still it's a happy Friday for me. Yeah, so it's Friday the 16th, I think, of April. That is now, what does that work out as? 8 days since my diagnosis of Hodgkin's Lymphoma, stage 3 cancer. And it is now 4 days away from my chemotherapy starting. Basically, today I had my COVID vaccination, my first one, because they need to get it in before I start, at least the first one before I start, to get the protection up. And it was a very strange experience, actually. I think because the new sort of rules and regulations, or the new advice is that people under 30 shouldn't have the Oxford Astra Zeneca jab. There's a big grey area around people, for example, like me, who have been diagnosed with cancer and have also had their jab arranged for them. I think the staff are a little bit tentative. Basically, what happened was this was arranged for me by my clinical nurse, Rachel, who was lovely and very efficient. It was signed off by my consultant, Dr. Rashid, who's equally good, just in case they're listening to me. And obviously today I had to go to the Queen Elizabeth Hospital in Woolwich, and it's an 11 o'clock appointment. I wasn't sure which jab I'd be getting. But when I got there, the sign on the conference centre, which is where it was being done, said Oxford Astra Zeneca. And yeah, so I thought, right, okay, this is going to be interesting because they've stopped under 30s from having it because of the very, very rare blood clot issue. Anyway, so I turned up. There was a massive queue around the block because obviously all of these people had been told 11 o'clock. So I waited in the queue. I got in, I went to the reception with a nice woman there. She said, took all my information and said, "Oh, Scott, are you under 20? Are you under 30? I said, "Yeah, I'm 28. And she said, "I need to get somebody to speak to because we're not actually administering the vaccinations to people under 30. And I thought to myself, okay. So anyway, she went off and got the man, the bloke that was running the department. I'm not 100% sure what his role is, but I know that he wasn't a medical professional. He was just somebody organising the event, if you like. Sat me down in the office that was like open plan with everybody waiting to go behind the curtains to have their vaccination, and was basically like sitting across the table like this and going, "Okay, so how old are you?" And I said, "I'm 28. And he's like, "Okay, you do realise that we're not vaccinating anybody under 30 with the Oxford Astra Zeneca jab?" And I said, yeah, I was aware of that, but I obviously wasn't certain of the rules considering I'm a cancer patient and in 4 days' time I'll be having my first infusion. And he's like, "Okay." And then he just basically said, put his glasses down, took his mask off, and was just like, "But are you aware of the risks?" And I was like, well, yeah, I am aware of the risks, but I'm also aware that I'm having chemotherapy in a couple of weeks, in 4 days' time, and I'll be having it every couple of weeks. And I know that, your immune system is suppressed, so I've got to have it done. Like the benefits outweigh the risks, and so I'm going to do it. And I said I stood firm with it. I was like, right, this is what it's going to be. Won't having any of it. Like they were really uneasy, and I understand that. They've got to be ticking their boxes. They've got to make sure that the it's not on their watch that somebody has a blood clot and dies. But also I'm a cancer patient and I need to have my jab. So basically, he asked me for the names of my consultant and my nurse, and I give it to him. And then he was just like, "Okay, so do you know where the clinic is?" I was like, "Yeah, it's in this hospital." I said, he went, "Why don't you just run over there?" And this was at like 20 to 12. I've been there since like quarter to 11. "Why don't you just pop over there and speak to them?" I'm thinking to myself, there's a reason why, people have appointments to see their consultants. It's because they're seeing other people and having meetings and helping people out, other people. I went, "Yeah, okay, I'll go over there. I'll just double check." He wanted me to make sure that, they've explained the risks to me. And so that's what I did. I went over to the Macmillan Brook unit. I spoke to the lovely receptionist. She made to ask me to wait until my clinical nurse Rachel had come out of the meeting with my consultant, and then I waited maybe like quarter of an hour, and then they said yeah, you and your partner can have it done. Like, you know, we're not concerned. You know, this is the situation that you're in, and ultimately, you know, the cancer treatment is gonna be worse, or you know, more life threatening, if you catch an infection or a you know, disease or a viral thing or anything like that that can be prevented. So it makes sense for me to take the risk and have the Oxford Astra Zeneca, the very small risk, very, very small risk. So I went, okay, great. Went over to the unit again where they were doing the vaccinations. And again, it was made to sit there for ages. Them asking me, like, pondering, going, ooh, should we do it? Shouldn't we? I was like, I've been told, like, you know, like, I've got it on good authority. It was them that arranged this. You know, it's been signed off by a consultant of haematology. Like, this has been booked in advance. I'm here now. I've been waiting for an hour and 40 minutes. I had to fill out my form whilst they all went, and kind of like, are you okay with this? And I was just like, yeah, like, God, give me the jab, for God's sake. Like, I want to go. My mother and Will are waiting, walking around a random field in the middle of nowhere. So yeah, when I eventually went in, I had a lovely nurse who was actually a bowel cancer nurse, and so I had a little chat about my cancer with her, which was nice. I know you take anything you can get at the moment when you want to speak to people. And she was just like, yeah, obviously, you know, the system isn't set up to take under 30s. There's nothing to write in the box. There's no boxes to write in to make any notes. So it is on us. So I understand that this is the situation. They've got to be careful because, you know, they don't want to be seen to be giving it to the wrong people. But she did say, you know, you've got cancer. Makes sense to have the jab. There we are. So I had it, and it was fine. Didn't really hurt. There was a little bit of a like numb sensation as it got further in, which is a bit strange. But yeah, done. Got it. First jab done. Got to make sure that, you know, I'm not getting severe headaches, but I'm also having chemo on Tuesday, and if you're going to get an issue with it, apparently it happens within 4 days to 2 weeks, and so who knows. So yeah, I'm a little bit bunged up now. Not bunged up, but I can still breathe through my nose, but I can feel a little bit of sinus issue going on. My ear's a little blocked. Other than that, I've got energy. It's really difficult for me not to have energy, mind. So maybe I'll wake up tomorrow and feel hungover. But yeah, got my COVID vaccination done. Next stop is chemotherapy. Have a good weekend, even though it may not be the weekend. Yeah. Bye.